Everyone, welcome to the Great Bruce Public Health Meeting for June the 23rd. We'll now start the meeting. We'll do the roll call, please. Okay.
Kenneth Craig,
Here.
Nick Saunders,
Here.
Colin Barfoot,
Present.
Sue Patterson,
Present.
Sue Carlton,
Present.
Helen Blair Tingley,
Good morning again.
Kevin Eccles,
Counted for.
Chris Peabody is going to be late, Brian Mill, Luke Charbonneau,
Okay, thanks, Jenny. Any amendments to the agenda? Dr. Aaron?
Mr. Chair, if we can add an item that came, communication from the ombudsman related to the last motion judgment.
So that would be on the releases? Or would you like to add that?
We can, add it under other business.
We don't have other business.
You can add it under correspondence restriction if you're for an
Okay, any other amendments to the agenda? Helen Claire?
Hi, Mr. Chair. Just no amendments. Just wanted to say that I'm struggling a little bit to hear. The audio is echoing a bit, and I'm not sure if anything can be done about that. It looks like my colleague Sue is agreeing with me. Thank you.
Now I'm going to put down the phone sign it. You're actually smart, you can put it down the phone sign it. Make it, to get the reflection off the glass. Thanks, Kaylee. Hopefully,
I
don't think she can hear.
Yeah, the volume's too loud on the.
when we close the windows, at the hour, I can see people.
Yeah, but the owl will set it. If there's too much, if it's too loud on the echo or on the owl, on the computer system. Yeah,
okay.
Is there a solution for that?
yeah, if there's this. Through the computer. You're gonna. Maybe it should. Is that better?
Morning,
They
Nick.
can't hear us.
Good morning, everybody.
Is that better, Helen Claire?
The volume is down.
Could you talk a little bit, and I'll let you know.
Is that any better now? Or too much of an echo?
It's still a little bit echoey. I don't, Mr. Chair, if you could like say something substantive, then maybe.
Paul
we
and Luke, see, Mr. Charbonneau has joined the meeting.
It's better. Thank you.
Can you mute everywhere on the website?
Yes. Everyone's muted.
Okay, so the minutes will now reflect that member Charbonneau has joined the meeting. Any other than amendments to the agenda? Being none, looking for a mover then to approve of the agenda. By Sue Patterson, second by Ken Craig. Any further discussion on that? All in favor? That's carried. Next, any disclosure of pecuniary interest for anyone? Seeing none, the adoption of the minutes.
Chair, Kevin Eccles has raised his hand.
Sorry, Kevin. Go ahead, Kevin Eccles.
I was just voting on the last and I hadn't got my hand back down yet.
Oh, okay. We are now to the adoption of the minutes, the Wednesday, May 24th. When you look at that, it looks a little confusing. What happened was we were having some technical difficulties doing that. I know, Nick, you joined to start with, and then it just didn't last very long. Brian Milne was the same. So it showed us that the meeting adjourned about 20 minutes after we had started, which wasn't the reality, but I think we lost form at that point, but it was a training exercise anyway. So we were able to continue on with that. But it's just for anyone to look at the minutes, they would know what's going on at that meeting. So I just wanted to be clear on that we still continued on with that training. So can we do this as one motion for the two, Kaylee, or do you want to do? Okay. So then we had the regular board meeting of May 26th. Then the minutes of that. So could I have a mover to put them on the floor then for those two sets of minutes? Mover, Ken Craig. Helen Claire, would you second that motion?
Will do.
Okay, just that on the screen, you're all froze on from here.
Dr. Aaron,
Up here.
can you go back to your team?
Yeah, now everybody's moving now. Okay, so we have a mover and a seconder then for those two sets of minutes. Any further discussion then on those minutes? None, call vote, all in favor? That's carried. Now we're down to correspondence and news release. Dr. Aaron, you doing the correspondence?
Yes, Mr. Chair, so we have 4 items under correspondence in addition to the one that was just added to the ombudsman. The first 2 items for correspondence are about the support of Bill S-254. The first one is from Algoma, the second one is from Public Health Sudbury District, and both of them call on the government to enhance the warning labels on alcohol beverages, and the recommendation is to receive. We have seen similar correspondence in previous months on the item. The number 3 is from the Public Health Sudbury District. It's a letter directed to the provincial government to support for improving indoor air quality in public settings. And the recommendation is to receive. The final one is from Middlesex, London Board of Health. And it is a response to the consultation for Health Canada related to restricting the commercial advertising for food and beverages directed to children specifically, and had a number of recommendations. And again, the recommendation is to receive. Totally be here. It's so the correspondence or the communication from the Ombudsman's office was related to the March 31st meeting that we had, and in that meeting we were to acknowledge the Ombudsman report and make a statement and approve it with a motion. And at the time, the statement that was prepared by the admin for the board and communicated to the Ombudsman was already circulated to the board in January and February. It was a response to the Ombudsman's office. Nevertheless, in the March 31st, there was discussion where that statement was changed. And we did not pass a motion, and the change was that we contravened the act versus the actual statement that's approved by the ombudsman. We did not contravene the act or procedure was issued. So the ombudsman's office mentioned that, well, you did not pass a motion to accept that you did not intervene in the act. And they don't usually recommend for us for boards to go back and correct it. Nevertheless, I would believe in quality improvement and in doing the right thing. So I would recommend to the board to actually pass the motion, makes the same statement that was approved by the ombudsman, and pass the motion. And at the end of the day, it reflects the truth that we did not intervene in the act, comparing to the March 31st statements that were made as if we intervened in the act, Mr. Chair.
Those are an actual motion then that we,
This is a statement, and it was circulated to the board and approved and sent to the ombudsman office in January based on the initial report, not the final report. So when we received the final report, we asked them if the same statement stands, and the ombudsman's office approved, and that's the motion.
Mr. Craig?
I do not disagree with Dr. Era's recommendation, but I'm wondering if it could be put on the agenda for next month's meeting so that we, I just want to have a chance to go back and look at my minutes here and, okay, I understand better what you're talking about. Is that an appropriate resolution of that? Like it's not a big deal. I agree, but I just want to know, I just want to understand a little better what it all means. So if there was, if it's not inappropriate to put it on next month's agenda, that would be my recommendation.
Do you think, Doctor, is it time sensitive that it go back, or?
It's not time sensitive, and it's up to the board to make that decision. It was circulated in January, and in March, there was, I think the discussion was, it wasn't circulated, but it was circulated. If there is need to circulate it again, definitely it's within the board to right to do that. There is no urgency to it, if that's the question.
I think in transparency, it makes it easier to follow if it's put on the next board's agenda to do that. So if we can, is there anyone opposed to doing that, we can make it on the next agenda? Any hands, so everybody's good with it being on, and then that way that statement will be there. Okay, thanks, Dr. Looking for a mover and seconder then to accept the correspondence. Nick, you prefer to accept the correspondence? Sure. Moved by Mr. Saunders and a seconder. Luke Charbonneau, welcome, Ward Peabody. Any further discussion then on the correspondence? Dr. Aaron?
Sir Chair, just a note, we received the correspondence or the communication 2 days ago after the package went up, and that's the only reason it wasn't.
Yeah. Just going to comment on the number 3, the one from Sudbury. At the Alpha conference that I attended a week ago, there was a resolution came forward regarding that with the air quality and changes that could be made. If anyone's ever been to an Alpha conference and you get in the resolution segment, that's about an hour of your life you'll never get back again, where people like to wordsmith everything from periods to commas to whatever. Anyway, long and short of it, there was an ask there in that resolution to possibly amend the building code. So we'll see where that goes at. So, any further discussion in regarding the correspondence? Call vote, then all in favor. That's carried. Now we're down to media release. Steve Denis.
Thank you, Mr. Chair, and thank you, Mr. Chair, and through you. There are 5 media releases on today's agenda. The first speaks to changes to Public Health Ontario's Lyme disease map, which identifies estimated risk areas for Lyme disease in Ontario. These are locations where black-legged ticks, which can carry the bacteria that causes Lyme disease, have been identified or are known to occur. As a result of tick surveillance in 2022, 2 new estimated risk areas have been identified in Grey Bruce, bringing the total number to 3. The Ontario Lyme disease map informs the public about these areas so they can take precautions. And the next 4 media releases relate to the special air quality statement that was issued earlier this month due to wildfires in Ontario and Quebec. The first, issued June 6th, advised the public of a special air quality statement for Grey Bruce, along with information on who is at greater risk of experiencing adverse health effects from wildfire smoke and tips for limiting exposure to wildfire smoke. On June 8th, the release was issued after the air quality control index in Grey Bruce was elevated to high risk, and a day later, Public Health advised that the special air quality statement had ended. And on June 12th, Public Health informed the public that the air quality index had returned to low risk. And those are the news releases for this agenda.
Thanks, Denis. Any questions or comments to Denis? Mr. Craig?
So I'm in support of the media releases. It's not the issue. When I get my agenda package and it shows up with the blue underline, you click on it and you expect a link to pop up, but there's no link there. Is that a difficult task to include the actual media release as a link in? Like, you don't need to print it off or anything, or if you just tell me if I have to go on the Grey Bruce Public Health website to find them, if that's the simpler way. But if it's not a big deal, just to have that link there, you can click on, oh, that's what it says. Okay. Is that
Yeah. Dr. Harris?
It should be included in the package as well as an article.
So they are.
They are correct.
Yep. Don't need to do that. And the funny thing is, I read it, but it just seemed logical that, if you want to save 5 pieces of paper, don't print them out here and just give us the link to do it electronically if that is
We can do that as well.
whichever, I
With the
don't
digital
care.
version,
It
we
just,
can change that.
Okay, any other comments and regarding the correspondence? Where to me by?
Is with the Grey Bruce tick map and the new areas being added. What's I know we had this about 4 years ago presentation. What's the methodology for gathering that data to change the map? Is it based on hospital visits, or do we have people going out and collecting ticks?
Sorry, if you can repeat that question.
Just wondered how we get the methodology, the data for the tick map. Are we still going out and collecting ticks?
Mr. Chair, through you, yes. That is generated through different sets of data, but one of them is tick tracking. So there is a team that
Okay.
examines the trends of certain ticks in certain areas.
Thank you.
Other questions regarding the course or the media releases? Seeing none, look for a mover to receive that. Who hasn't got on the board yet? Susan Carlton, and second by Kevin Eccles. Any further discussion then regarding the media release? Follow and all in favor? That's carried. Thank you. Next, we're down to the medical officer health update. First one is the opioid situation. Dr. Zaid.
Through you, Mr. Chair, I would like to share a presentation for the update for for today's update regarding opioid toxicity, I have 2 items. The LDCP prevention project update and SOS dashboard and project charter update. So in terms of the LDCP project of prevention, we have finalized the project like the part of literature review and the survey, and it will be submitted to Public Health Ontario end of June, like in a week. And in the same time, there will be a plan for knowledge dissemination with public health units and with policy decision makers, and also the federal government who is interested in the prevention project that we have for their 5-year approach or 5-year strategy on prevention. So it's going very well, and the preliminary draft is really a great combination of public health inputs in addition to the literature review and the recommendation that hopefully it will be helpful for prevention strategies for youth, for opioid prevention of opioid and unregulated drug use among youth from 14 to 25 years. So that's the first update. The second update is about SOS. So as you know, this is an outreach mobile project with multidisciplinary team, and the planning and evaluation and monitoring is conducted by public health. So part of this project has been really critical and very instrumental in reducing the deaths and the emergency department visits from in 2022 onward. And one of the things that we need to add is to have a dashboard to evaluate the project and monitoring it and extract data that are important at any time. So we finalized the dashboard, and I just want to show you some few slides about this dashboard. So it's an interactive dashboard. You can see here the demographic with the age group. Another slide will show here the interaction. So it's very important for us to know the returning rate, returning versus new clients, or so that's an important part. So retention rate is also important. That's the number of drug used here. So that's the kind of drugs. You can see the crystal meth is the highest one, and there is also the fentanyl and alcohol, like different kinds of drugs. So that's important to know, and it also is profiling or a reflection of what is going on in the community. This is a number of value remapping that shows addiction services, medical intervention, social support. So we try to categorize. For example, you can see the medical interaction here. You can see a category under opioid treatment, many things under testing like blood work, COVID testing, infectious disease, blood work, something like service, stat service, pregnancy urine test, routine blood work, sexually transmitted infection. So many things can be under testing, and there is also under treatment. There are many items. So we try to compile this service into bigger categories. So this is here showing the site service and the number of service here, like addiction medicine, counseling, and case management, and the education, primary care, and support. So these are the kind of service categorized by month. And here is medical intervention provided, including opioid treatment, including testing and treatment care, which is like the counseling and mental health support. This is a slide showing the referrals to different services, to hospital or primary care, and it's also categorized by age. And finally, this is showing basic needs support that is also provided, including foods, personal items, clothing, and other like including, for example, navigating the system, social healthcare navigation, healthcare system navigation, or social service navigation. These are all having the health card for some clients. So that's in a nutshell the service, and we also finished the just to stop with the share here. I don't have a stopping the share. So, yeah. This one? Yeah. Okay, to share. So, there is no, I can scroll down. Okay. Okay. So that's in a nutshell the whole services and the indicators. It's important to have this project charter finalized, and this dashboard will help us to know at any point in time or annually to have a report for how the service is progressed. Another just item related to that, we knew from the news about some outreach service or mobile van coming to Bruce County, and it's a mobile van for addiction services. We were not aware about it, and I communicated with the Bruce County counterparts in the CAO, and they have no information about it. So is the emergency department in Bruce County, they have no information. So they mentioned that they were not aware, and they were alerted through news articles, and will be inquiring through various ministry partnerships channels as opportunity presents. And they don't understand either do we how it connects to the local services and what it entails. So they say it's a black van with nothing, and people can go, and this is the first outreach service in the area, which is not true. So just if Bruce County councillor can tell us what it entails, because even Bruce County officials, they don't know. Yes.
Where'd be like?
Yes, well, I was at the van, I was at the press conference, and so it will be based out of Goderich, and it's run by a nonprofit, Medivay, but and it will have a mental health nurse, social worker, two workers in the van, and it will be for Perth, Huron, and Bruce. And it's an initiative of the Minister of Mental Health, Minister Thibodeau. And yes, there was concern at the press conference that was held in Clinton about the lack of input from, for example, CMAH. They were on CTV at the press conference expressing concern about that. So I know there is a meeting. I'm not included in it. Next week with the different the different hospital groups, and I don't know if public health got an invitation to that. I'm not coordinating that, but I know Lisa Thompson's office was trying to include all the stakeholders. But the model of the bus would be based out of Goderich, and it will be visiting people and serving them through the bus and it will include appointments, or it may just be in covering Bruce County Kincardine on a given day. But other than that, I was just at the press conference to give to thank them. I don't have all the details either. So that's anyway, bottom line is you should find out, doctor, if you can get in on that meeting next week with the different stakeholders.
Through you, Mr. Chairman, I want to show how it is very difficult and complicated to get monitoring of services. So I am just concerned and express my concern first that Bruce County has no information about it, and nobody knows about the details and how it coordinates with the local services and how that will improve the quality. Like this kind of project is appreciated, but if it's done in that manner, I think it's really concerning. Thank you.
Okay, do we have an invitation for public health to next week's meeting? And if not, I can contact Lisa Thompson's office to find what it is for you. Dr. Ayer, should I do that? Should I get the date? Or
Through you, Mr. Chair, we will welcome any invitation, but in the press conference, it's not the time to plan the services and align them. Like, for example, when we put the SOS, when Dr. Zaid put SOS, the service in Gray, we connected the paramedics with the hospitals, with the shelters, with the primary care. So all this, I don't believe it is done for this extra service that, again, like Dr. Zaid said it rightly, appreciated but concerning.
And through you, Mr. Chairman, I just want to add that when we start that at Gray County, Bruce County was involved and in partnership in every step, and their emergency medicine, they were involved and they were simulating that, and they are actually involved in sending us reports of any toxicity or so it's really, there is a lot of coordination between the two counties. And I just want to say that also the SOS project and the work that we are doing for outreach service is not only for Gray County, it's including both counties. Thank you.
okay, well, yes, SOS has been a great assistance to Bruce County, and thank Gray County for that. And I will pass that along. I was there at the press conference as the warden. I was not involved in any of the planning. I just went there as warden to thank them for the bus. So other than that, I don't know anything about the service delivery, and I know they're backtracking now on including the stakeholders. So I will call Lisa Thompson's office.
Thank you.
Maybe an email to the minister asking for clarification on what they are actually doing.
Yeah.
Might be appropriate. I'm just wondering who should send it, because it sounds like it's been organized confusion. And copying Lisa on it, but I think it should go right to the minister to say that. What are you doing?
Mr. Tiblo, yeah, his office would be good.
So just to clarify, who should send that email then to the minister?
Yourself, in cooperation with Dr. Ayer and Dr. Zaid, you're the spokesman for this group anyway, so.
And through you, Mr. Chair, I would agree with that. We communicated with the minister's office 2 times, and we requested resources and support and communication. So that would be an extension of that to say, thank you for this meeting too.
Okay, all right.
More information about it.
We'll coordinate an email through that then. Okay, just backtracking again to Dr. Zaid's presentation. Any questions regarding her presentation on the opioid update? Okay, could I have a mover then to receive her presentation of today? By Lou Charbonneau, seconder. Sue Patterson. Any further discussion on Dr. Zaid's presentation? All in favor? That's carried. Next is Dr. Ayer. Are you doing the tobacco one?
Correct, Mr. Chair. So this is just a brief report about one of the functions that we run in the health unit for affirmation decisions required. It's the Grey Bruce Public Health Smoke Free Ontario Act School of Fence program. So this program receives complaints from the schools whenever a student is contravening the act and smoking on school property. So our team will be connecting with the school official, with the student, offering support, exploring why the student starts smoking or is smoking. We offer them also connection with the school health program nurses, and there's a wide array of services that support individuals and families in this. And just in terms of statistics, and this year we received around 50 of these reports or offenses, and our team responded to every single one of them. And the statistics across Canada is alarming about vaping specifically in youth. And that's through the Canadian Student Tobacco and Alcohol and Drug Survey. The last report we received was from 21-22 survey. And one of the indicators, for example, indicates 15% of Ontario students grades 7 to 12 reported vaping at least once during 30 days. It's one of these indicators. Again, the number 15 in the trend from previous years is high. It's quite high. So we continue to provide this program. During this time, we have a number of school health nurses that their work on COVID is way less, and they have been connected with these families and students that require help as well. So that's a report, Mr. Chair, just for information.
Okay. Questions? Mr. Charbonneau?
Yeah, thank you, Mr. Chair, and thanks for that report, Doctor. I just wonder, can you, the purpose of this particular program is to prevent youth from smoking, which is really important, and we've seen the impacts in our own region of cigarette smoking on the general health of the public. The issue here is more vaping, and I wonder if you could just give us the Coles notes on the public health concern specific to vaping. What is it that we're worried about with people vaping in terms of their health?
We, Mr. Chair, vaping have the same concerns like tobacco smoking, and added risk of chemicals that's included in the substance that we don't know the effect of long term. For tobacco, we have studies for 50, 60 years, and the results are not reassuring at all with tobacco. Nevertheless, the programs and the prevention measures and the response to tobacco has been very successful over the past 50 years, where it used to be common in any public space in hospitals, and now it's not common at all. And with vaping, we have the same concern, and as I mentioned, the added risk of chemicals, and the fact that it's commercialized towards kids, the marketing of it, the flavors, it's usually not designed for adults. That's one of the main concerns there.
So if I could, Mr. Chair, just to follow up then. So I'm interested in the current status of the sort of the scientific knowledge around the impact of vaping. I mean, that we, as you know, as you rightly point out, we know conclusively about cigarette smoking and the negative deleterious health effects of that. That's been well studied and well understood. Do we have a similar base of knowledge? Like you said, we don't know about the impact of whatever chemicals, whatever else may be, and what do we know conclusively about vaping in terms of its impact on everybody? I see a lot of people. Targeting youth is one thing, but a lot of people are adults vaping. I just wanted to get a sense, like, what does science tell us about how specifically vaping might hurt people either in the short term or over the course of their lives?
Certainly, through you, Mr. Chair. After 1 year of rolling out vaping in Canada, there was a report that came out from Johns Hopkins, very reputable medical school, a pathology report of the effect of vaping on the lung tissue. The assault on the lung tissue, according to that report, was not seen in other incidents except for the mustard gas in the First World War. That effect, and that was within 1 year of vaping. Again, you know, the long term is not known, but the short term can be detrimental.
Okay, thank you, Mr. Chair.
Dr. Zaid?
Through you, Mr. Chair, there are some evidence from the UK. They have started this studies long time ago. So first, if there is like a controlled nicotine percentage, and it's only nicotine, it might be helpful for people who were smoking and can quit smoking through that. So, but it should be under really good regulation and known content. For first-time users, it is concerning because it is a gateway. So there is this paradox. It can be a way of quitting smoking over time for people who are smoking tobacco. But for first users, it is concerning. One of the concerns is related to bronchoalveolar injuries that has been still controversial. But the other thing is also a gateway for other things like vaping, other drugs, opioid or other drugs. And the other thing is, again, as Dr. Ara mentioned, the other material that we don't know if people are ordering it online, you don't know these flavors. And the third thing that they are studying right now, and it just need more time, is second and third hand smoking, same as tobacco. So what is the effect? Yeah, we don't, sometimes there is no odor or it's just vapor. But still there are some preliminary studies about second-hand vaping and third-hand vaping. So second-hand meaning people who are around the person who is vaping, and third-hand is these aerosols that can be precipitated on walls or furniture. What are the effect of that? And this is the studies right now.
Thank you.
Great stuff. Oh, there. Okay, any other questions for Dr. Ayer regarding his presentation? Okay, seeing none, could I have a mover to receive Dr. Ayer's presentation then? Mr. Craig, seconded by, I think I've seen Sue Carlton with her hand up. Any further discussion then on the Dr. Ayer's presentation? All and all in favor, that's carried. Next, we're down to the audit report. So seeing Kim there, is Tracy or anybody from BDO they're going to be in person, or are they going to be just online? Hi, Tracy, how are you?
Good, how are you?
Good. Okay, well, we'll just turn it right over to you, Tracy. How's that?
Okay, just Kim, did you want to say anything before I started?
Nope, floor's all yours, Tracy.
Okay, so I believe that you have our report in your council package. So I'd like to thank the board for inviting me to your meeting this morning. I'd also like to thank Kim and the finance team for all their assistance in completing the audit. The report in your package is our required communication to the board. I'll provide just a brief summary of the required communication and then provide a very high level overview of the draft financial statements. On page 3 of the report, it's an executive summary. As your auditor, we have the responsibility to communicate with those charged with governance, which is the board, on an annual basis. And again, this report contains all that required communication under auditing standards. The report is very similar to last year, as the content is prescribed by the auditing standards on the content, and so the content is again similar every year. In the executive summary, we highlight that the draft financial statements need approval by the board before we can release the finals. Once we have approval from the board, then we do have to do some follow-up work before we release those final financial statements. Independence, we do confirm that BDO is independent of the health unit so that we can provide an independent audit opinion. The materiality was $500,000. That's based on 3% of average revenues, which is standard for public sector entities. In the balance of the report, there is our communication on the internal controls. There were no internal control issues or other issues that needed to be brought to the attention of the board. Unadjusted differences are on page 7. They are very, very small and not material, so we can issue a clean audit opinion that the financial statements are not materially misstated. And then our audit opinion can be found Appendix A. So that's just a brief high-level overview of the communication, and if there are any questions, I'm happy to take them during the presentation. I think I can see most of you there, so if you want to just wave, I can stop. But that is a summary of the communication, and then I'll go to page the Appendix A, page 2 of the financial statements. So just as I'll give you just a minute to scroll to Appendix A and page 2, which is our independent auditor's report. And as I'm scrolling at the same time. Okay. So any questions on the communication? Okay.
See many hands, Tracy.
Oh, yeah. Our independent auditors report, it's management's responsibility for preparing the financial statements. It's the auditor's responsibility to give an opinion on the financial statements prepared by management. Our opinion, it is an audit opinion, so that's the highest level of assurance that we can provide as a public accounting firm. And our opinion is in paragraph 2. In our opinion, the financial statements present fairly in all material respects the position of the health unit in accordance with Canadian public sector accounting standards. Therefore, it's a clean opinion. We had no issues or concerns that came to our attention during the audit. On page 4 of the financial statements is the statement of financial position of the balance sheet. So again, a point in time on December 31st of 2022. Total assets were $6.3 million, mostly in cash. The cash fluctuates depending on when your subsidies are received. It is higher at the end of 2022 as there was over 1.7 due back to the province. The amounts back to the province show as a liability down below in the liability section there, and they are detailed in note 3. Funds were received in advance. Funds are received in advance, and the unspent funds due back are in that included in that liability at due to province. It is higher than the prior year, mainly due to over $1 million relates to excess COVID funds that were flowed that were not used in 2022 as the pandemic was winding down in 2022. So the deferred revenue in the liability section are the programs that run to March. Those are funds that you've received in advance that you will still be spending in January to March of 2023. I do want to the total liabilities were $13.8 million, and the largest portion of that is the long-term debt. Long-term debt was 8.6 million. Just want to highlight that those are two loans that you've had for a long time. But the nice part of that is that those loans are at 4.82% and 3.03%. And they don't mature until 2033. So you will be benefiting from the lower rates when prime rate is now at 6.95%. So that's good for the health unit. The net financial debt. So it is the health unit is in a debt position that represents the borrowing to build the building, so that the net financial debt decreases as the debt is paid off. So you did pay off $626,000 in 2022. The tangible capital assets, again, is mostly the building, some equipment and furnitures at cost, and that's at cost less the amortization. The accumulated surplus of $1.5 million is essentially your capital reserve. So you do have a small capital reserve of just over $2 million, less the unfunded post-employment benefits and vacation pay. So the capital reserve will increase from your MOE rent, less any small capital expenditures that you make using those funds. On page 5 is the statement of operations. It's the transactions for the year. Again, it's consolidated. It includes all the programs of the health unit. Total revenues were $18 million. It has decreased since less funding and expenses for the COVID vaccine program were needed in 2022. On the off side of that, you are having more funding and more expenses now moving into the seniors dental program. The county funding, it remained at 2021 levels, so no change in that for 2022. Total expenses were $17.6 million, and that does include $971,000 in amortization. That's not funded. That's an accounting PSAB adjustment that has to be made to report on your final financial statement. So it's a little different from your cash-based budget that you will look at when you have your internal reporting. The annual surplus, again, that's not actually excess funding by the province or the counties. The funding revenue was recorded to match the actual expenses incurred, and any funding to be received or repaid is shown on the balance sheet in that due to province. The annual surplus that you see here includes funding that you've received for capital assets and the principal debt payments, less the non-cash amortization. So the surplus is adjusted on the next page for those capital transactions to get back to closer to your cash-based budget. So on page 6, the annual surplus, we adjust it for the amortization in your capital purchases, coming down to your decrease in net debt. So the decrease in net debt is the funds that you've received to pay down the principal. You do get funding, some funding for that, and the remainder is the MOE revenue that you're accumulating as your small capital reserve. So the ministry doesn't allow for any allocation to reserves. So the only funds being set aside are that MOE rent, and at December 31st, there is a small capital reserve of just over $2 million. So that concludes a very high-level overview of the financial statements. Are there any questions for myself or Kim?
Hey, any questions, Luke?
Yeah, thank you, Mr. Chair, and thanks, Tracy and Kim, for all your work on this. I just wonder, I'm interested in the cash that the health unit is holding, and just what it's. I can see based on just a quick bit of math, we owe 1.7 million back to the province, give or take. So we're sitting on about $4 million in cash. At least that's how I read it, and I might be wrong. What is the purpose of that cash? Where is it? Is it heading somewhere? Is it used in some way, or is it just cash that, because it seems to be over a couple of years, in the 2 years reported here, we had a pretty significant cash position at the end of each year. Maybe you could just clarify that for me so I can understand it better.
Yeah, so you also owe $2.5 million in accrued accounts payable and liability. So again, that's timing of amounts that are going to be, that are needing to be paid for suppliers and for payroll. So you got 2.5 in accounts payable, you got 1.7 million due to the province. You've got $361,000 that you're holding for programs that you're spending in March to April. So you actually really don't have a whole lot of cash when you add those amounts up.
So it's just a moment in time. Most of that money is churning around in cash flow, and doesn't amount to money that we're holding year over year.
Yeah, and Kim can clarify there too.
Kim?
Oh, you're on mute, Kim.
Yeah, through you, Mr. Chair. We did look at our cash balance last year about whether it made sense to invest in like a GIC or some kind of fixed rate bond. Ultimately, we looked at the interest we were earning on our bank account under our current banking agreement and what was being offered in those. And with the predictions of what the market was going to do and that prime was only going to climb, it didn't make sense to lock in at that time. And we're actually in a more favorable position with what we're earning right now than if we had have locked in at those rates for 3 to 5 years that they were offering at the time. So we did look at it last year because we've had a higher balance than normal. And it's difficult to know how much cash you're going to have because that 1.7 million that's sitting there, the ministry could send you a letter tomorrow saying they're recovering it next week. So you need to have it available. So sometimes they're a little slow recovering it, but we don't get a lot of notice when they decide to recover it. So you do need to be somewhat liquid with your cash so that when they want those funds, you do have it available to repay them. But we did look at it, but we've actually come out more favorably having not locked into those rates last year.
Thank you.
Thank you. Any questions from anyone else? I guess the only question I have, Tracy, is there any areas of concern that you see at all on this year's audit?
No, we had no problems with our testing when we did our testing of controls. So there was nothing that came up during the audit.
Perfect, good. Well, that's kudos to Kim and her team. So congratulations, Kim, on that. So can I have a mover then to receive the BDO report for 2022? Mover, please. By Helen Clare. Seconder. And Mr. Eccles' his hand up there. Any further discussion then on that motion to receive the BDO report? Call then all in favor. That's carried. Thank you, everyone.
Thank you for having me.
Thanks, Kim. Or sorry, Kim, next then is the agenda. Under corporate services, financial report then for April, Kim.
Yes. Okay, so through you, Mr. Chair, this is the April 2023 financial update. So at the end of April, we were in a surplus position of $113,000. If you look at the year-to-date budget column in the operating statement, you'll see at the bottom of the statement that we've budgeted for a surplus in the first part of the year. So we expect that surplus to decrease in the latter part of the year when the school-focused nurse funding ends in June. So we've budgeted to keep those positions that are being funded under that initiative for the remainder of the year, using our base funding to cover those costs. So that's what we expect will kind of utilize that surplus in the latter half of the year. you know, as we still need those additional staff for catching up and recovery in most of our program areas. Year to date, our mandatory programs and COVID programs are still fully funded with our allotment from the ministry. The seniors dental program still has a small deficit, but we're just monitoring that monthly and like managing it closely. For funding, we're still waiting to receive our funding announcement from the Ministry of Health. That announcement will tell us whether the 2.5% increase we requested has been approved or not. The most recent update I have from the ministry is that they're aiming to release the information by midsummer sometime. So we're just still waiting on that communication. We are currently under budget in our salaries and benefits year to date. We've had some unplanned leaves and we've had some gapping in positions while we recruit, which has created the underspending in those lines. For our operating expenses, the April expenses exceeded the budget by 19,000 as we had higher expenditures in the dentist and denturist fee line. So that's associated with the senior dental program. But overall, year to date, our operating expenses are still under budget by $41,000. So we're still in good shape in those areas. For the Walkerton Dental Clinic, we're close to having our procurement documents ready for the construction component of the project. We hired a cost consultant to review our drawings and give us a preliminary estimate. And that estimate was a bit higher than what we thought budget-wise it might be. So the project team did look at the drawings and made a few adjustments where they could for some possible cost savings. But you know, there's still program needs and IPAC considerations that we have to factor in. So those revisions have been made and they're into the drawings now. And so we're hoping to get the RFP out very soon and get some actual proposals and contracts in. So then we'll have a better idea of what the true construction cost of the project will be. And then that's the end of the updates.
Okay, thanks, Kim. Questions for Kim on the April financial report? Okay, we'll move her then to receive Kim's report for April by Sue Patterson, second by Warden Peabody. Any further discussion then on presentation? All votes in all favor, that's carried. Thanks, Kim.
Thank you.
Just going to add one question here, and I should have declared it or asked it earlier on the training, second training session. Haley, has everyone responded? Okay, we asked last month for everyone to submit on those dates. We can't schedule a people until we get everyone's correspondence back. So if you could please respond so we can get that completed. And the dates were all in July, if I'm not mistaken. Okay, so for those that are not, please, so we can get that scheduled. Okay, next then we have the camera. It will go very quickly. So instead of taking a break, or do you want to take a break, or do you want to just, it's going to be very okay, let's roll the camera to discuss the two items that are listed on the agenda. Moved by Sue Patterson, second by Sue Carlton. All in favor, that's carried, so we'll just wait till, okay, thanks, Kelly. We're back to regular session, so as chair, I heard that we only discussed the items that were on the agenda, 10.1 and 10.2 are the only items that were discussed. And now we'll look for a motion to adjourn our meeting for today. And everyone's participated by name, but moved by Nick that we adjourn, seconder by Ken, all in favor, that's carried. Thanks, everyone.
Bye, everyone.
Seeing everyone next month.